Welcome to The Body and Soul Guard, the channel dedicated to holistic health. In today's video, we focus on a topic that is both fascinating and challenging: narcissism and narcissistic personality disorder, NPD. Did you know that every child is naturally narcissistic? It may sound surprising, but it's true. In early developmental stages, children exhibit what psychologists call primary narcissism, a normal phase where they are the center of their own universe. This stage is crucial for developing self-esteem and a sense of identity. However, as we grow, most of us learn empathy, develop deeper social bonds, and move beyond these narcissistic tendencies. The journey from this innate childhood narcissism to mature emotional and social intelligence is fascinating and complex. Understanding this transformation can shed light on why adult narcissism, when persistent or excessive, indicates deeper psychological challenges rather than mere self-centeredness or vanity. This insight invites us to look beyond the surface and explore the intricate dynamics that shape our personalities and relationships. What is the difference between narcissism and narcissistic personality disorder? Narcissism is a term often misunderstood. It is described not as a personality trait but as a pattern or collection of traits. It encompasses behaviors and attitudes characterized by self-centeredness, a need for admiration, and a lack of empathy for others. Narcissism exists on a spectrum, with some individuals displaying these traits more strongly or frequently than others. It is widespread and can be seen as part of a person's personality without necessarily being pathological. On the other hand, narcissistic personality disorder, NPD, is a diagnosable mental disorder listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM. NPD is characterized by a pervasive pattern of grandiosity in fantasy or behavior, a constant need for admiration, and a lack of empathy. The disorder is seen as the extreme end of the narcissism spectrum, where these traits significantly impair an individual's ability to function in personal, social, or professional situations. The prevalence of NPD is estimated at about 1 to 3% of the population, partly because individuals with NPD often do not seek treatment as they do not believe they have a problem. The difference between narcissism as a trait or pattern and NPD as a disorder has significant implications for understanding and treating each. While narcissistic traits can be problematic and affect relationships, they do not necessarily constitute a mental disorder. In contrast, NPD is a clinical diagnosis that requires meeting specific criteria and often needs professional intervention for management or treatment. This distinction is crucial for understanding the nature and severity of the behaviors and determining the most appropriate response or treatment approach. What are the challenges of a diagnosis? Diagnosing narcissistic personality disorder involves several challenges. Narcissists typically do not seek therapy out of personal distress. The distress that usually drives people to seek therapeutic help is often not perceived in the same way by narcissists, as their self-perception and approach to problems differ significantly from non-narcissists. Narcissists tend to externalize problems and challenges. That is, they blame other people or circumstances for their difficulties instead of recognizing their role in these problems. This tendency minimizes their internal distress or leads them to believe they do not have a problem that needs solving. When narcissists do seek therapy, it is often due to external circumstances or crises, such as relationship problems, professional setbacks, or legal issues that are so severe they cannot be ignored. In such cases, the distress is caused by the consequences of their behavior on their social or professional life rather than an inner insight into their psychological distress. These extrinsic events can be the catalyst that drives narcissists to seek help, even if the primary motivation is often to fix external circumstances rather than pursue deeper inner change. Narcissism as secondhand smoke for mental health. The term secondhand smoke of mental health aims to illustrate the indirect but profound impact narcissist behavior can have on those around them. Just as secondhand smoke affects the health of non-smokers nearby, the manipulative and self-centered behavior of narcissists can cause significant psychological harm to their victims. These damages can manifest in various ways, including emotional distress. People regularly exposed to narcissistic manipulation can experience persistent feelings of worthlessness, anxiety, depression, and confusion. Erosion of self-esteem. Constant criticism, devaluation, and the narcissist's need for superiority can undermine victims' self-esteem and lead to a distorted self-image. Relationship difficulties. Victims may develop difficulties maintaining healthy relationships as they learn mistrust and fear of intimacy from the narcissist's manipulation. By describing narcissism as the secondhand smoke of mental health, we emphasize the importance of recognizing and addressing the impact of narcissistic behavior not only on the narcissists themselves, but also on those who interact with them. It underscores the need for awareness, support, and resources for those suffering from the effects of narcissistic manipulation. What are the consequences of narcissistic abuse? The consequences of narcissistic behavior are far-reaching and often painful, especially for the victims of narcissistic abuse. Through education and awareness, we can make a difference, offer support, and help build resilient, healthy relationships. It is crucial to recognize and understand these behavior patterns to prevent narcissistic abuse and support those affected. Simple tips for dealing with narcissism. Set boundaries. It's important to establish clear boundaries. Self-care. Don't forget to take care of yourself. Narcissistic behavior can be exhausting. Take time for activities that bring you joy. In the next video, we will focus on another critical aspect of narcissism: narcissistic manipulation tactics. We will explore how narcissists influence and control others and provide strategies to recognize and protect against these tactics before finding yourself deeply entrenched in trauma bonding. Thank you for watching this video. And remember, by loving and respecting ourselves, we teach others to do the same. Until next time, thank you for watching this video. If you enjoyed the content and want to see more videos like this, don't forget to hit the like button and subscribe to my channel. This way, you won't miss any of my future releases. If you have any thoughts or questions, feel free to leave them in the comments below. I look forward to hearing from you.